Hello, my name is Ryan Nazari. I'm a third year medical student at Kansas City University, and today I'll be presenting our case study titled Early Detection of Seizures in Coulon-de-Vries Syndrome for Improved Neurocognitive Outcomes. This case just kind of highlights the critical need for routine and serial EEG monitoring in patients with Coulon-de-Vries syndrome to detect subclinical seizures earlier and prevent neurocognitive impairment. So, Coulon-de-Vries syndrome is a rare genetic disorder caused by a deletion on the cancel-1 gene on chromosome 17. These patients will typically present with developmental delays, hypotonia, dysmorphic features, and intellectual disability. Up to 50% of these patients will experience seizures, and within that subset, 65% have focal impaired awareness seizures. These are seizures that can present pretty subtly, often as brief lapses in awareness, leading to delayed diagnosis and intervention. Despite this, there are currently no formal EEG screening guidelines for Coulon-de-Vries syndrome patients. So, focal impaired awareness seizures are difficult to recognize because they often present as staring episodes or behavioral changes rather than convulsions. In Coulon-de-Vries syndrome patients, these symptoms can be misattributed to their cognitive delays or new attention issues rather than possible epilepsy. And since there's no standardized EEG screening recommendations for these patients, these seizures can remain undiagnosed for years, leading to progressive cognitive decline. Our case focuses on a 9-year-old male with Coulon-de-Vries syndrome diagnosed at birth, both with the typical features and genetic testing confirming that deletion of the cancel-1 gene. In addition to his classic Coulon-de-Vries syndrome features, he exhibited hypoplastic 12th ribs, which is an uncommon skeletal finding in this condition. And from a young age, he had episodes of forgetfulness, mood swings, and outbursts. These were reported mostly by his mother as well as by his teachers in school. With these complaints, his doctors had suspected dysautonomia rather than any seizure activity. However, his teacher reported frequent spacing out episodes at school, which his mother kind of recognized. And in addition to new onset vomiting with these episodes that he was having, it prompted her to request further evaluation from his doctors, specifically looking for an EEG. Despite his symptoms occurring for years, his first EEG was performed at age 8, which is a significant delay. That EEG revealed abnormal activity suggestive of seizures, and although he didn't quite meet the criteria for continuous spike wave in sleep syndrome, he was treated for it accordingly and with Valium. That resulted in substantial cognitive and behavioral improvement from both his mother and his teachers, as well as reduced seizure activity on repeat EEG. And had that EEG screening been performed earlier, it's likely that his seizures would have been identified and treated sooner, preventing years of cognitive decline and lack of proper treatment. So this case just kind of highlights the major consequences of delayed EEG screening in Coulon-de-Vries syndrome. Without an EEG at an earlier age, the patient suffered years of undiagnosed seizures, negatively affecting his cognition and learning ability. And had a routine EEG been conducted earlier, treatment could have been initiated sooner, likely preventing the extent of his neurocognitive deficits. To prevent these delays, we wanted to propose a routine EEG screening strategy for Coulon-de-Vries syndrome patients, and this would include something along the lines of an initial EEG at diagnosis of Coulon-de-Vries, even in asymptomatic patients, as well as serial EEG monitoring at scheduled intervals, such as every 1 to 2 years. This, along with continued EEGs if new symptoms arise, including other behavioral changes, new onset cognitive regression, or new movement disorders. And by identifying subclinical seizures earlier, we could implement treatment before cognitive decline occurs. So, in conclusion, seizures in Coulon-de-Vries syndrome are often undiagnosed or misattributed to cognitive delays. This case emphasizes that routine and serial EEG monitoring could improve long-term neurocognitive outcomes in Coulon-de-Vries syndrome patients, and that future research should investigate the optimal frequency of EEG screenings in this population and how early detection influences treatment response and cognitive function. And ultimately, establishing standardized EEG guidelines for Coulon-de-Vries syndrome patients could prevent years of avoidable cognitive impairment. Thank you.